Yeah, man. After a very long weekend, having some live with Uncle yesterday, today is another day. A big, good day that we are to do some things. We want to do some things like discuss about the topics that we were rolling with, heart diseases, some other kind of heart diseases. And what are these other kind of heart diseases that we know? We talked about something that is called cardiomyopathies, and cardiomyopathies are kind like heart diseases that are away from heart attack, heart diseases that are away from heart attack. Now, as we come in and as we talk about, check out this. I'm still creating 1, 2, 3 things here. Still creating 1, 2, 3 things here. Okay, now. Yesterday we had a live with Jamaican Uncle, and it was a nice, good live. If you can watch it, you will feel entertained and you will feel rejuvenated. Now, let me talk about cardiomyopathy. Cardiomyopathy is a series of heart diseases that affect the heart and the pumping power of the heart. And you know, when your heart is affected, what comes in? You start having some things, issues with pumping blood, issues with oxygen levels, dizziness, all those, dyspnea, fatigue, all those things come up on you. So today we are continuing. We started with dilated, we went to hypertrophic. Today we are dealing with today we will be dealing with restrictive. So just to go on and remind ourselves what we talked about. We talked about heart diseases where your heart expands, and when your heart expands, the pumping power becomes a problem. And you know, when your heart expands, the vessels inside have a problem. Like when you check on this heart, when the heart expands, the valves move away from each other. So when the valves move away from each other, even blood, we have regurgitation. Blood comes back. As it pumps, blood comes back. If it pumps, blood comes back. So welcome everyone who is watching to today's series. This is Dr. Ben, and the channel is Benjamin the Wise Guy. If you have any medical question, you can ask. Always be free to ask any question. I can see more people coming in. Don't just come in. Tell us where you are watching from, and if you have a question, please add. And even not a question, if you have something to tell everyone, tell us. Rokata Exotic says, greeting Dr. Ben and everyone in the chat. Rokata, welcome to the chat. Today I'm talking about heart diseases. Some people have big heart that expand and they cannot. You have had some people that have been told you have a big heart. El Concaine 95, almost finished, don't stop. El Concaine 95. El Concaine says almost finished, don't stop. So if you are coming in, please remember to tell us where you are watching from and where you are watching me from. Don't just text. It's good to interact and say where you're coming from. And remember to hit the like button. Remember to hit the like button and subscribe to the channel. If you have not subscribed, just subscribe to the channel. Let's increase the numbers, right? Let's increase the numbers. So have you ever gone to a hospital and you have told that someone has a big heart and a heart has expanded? Ahmed, peace be upon you, man. Ahmed is here. Nice one, Ahmed. Thank you for tuning in. I'm cool, Ahmed. I'm cool. Today, if you have any medical question, ask as we continue. How are you? I'm fine, Ahmed. Very fine. I can see more people coming in. Please, if you are coming in and you don't know me, I'm Dr. Ben. The channel is called Benjamin the Wise Guy. Sandra, F3, F21, F2I. Sandra, hi Benjamin. I'm cool. I'm very fine, Sandra. Sandra, how are you doing? I know you're doing good wherever you are. If you're coming in, hit the like button, subscribe if you have not subscribed to get the notification, and always tell people here we discuss about good things. So, my premier 10 minutes after. No problem, no problem. Ahmed, nice one, nice one. So, I was talking about heart diseases. Apart from heart attack is whereby it's called myocardial infarction. You lose oxygen and then the heart muscles starts having a problem of pumping blood. But now we have these other diseases of the heart that are called cardiomyopathies. Cardio, the heart, myopathy problems. It's so dilated. The heart has dilated. Look at this heart. Look at this heart. Look at this heart. If you look at this heart, if it dilates, this valve will not be okay. This valve will be having a space, and that's what I'm saying. Dilated cardiomyopathy, the heart disease that your heart is bigger, and then you start feeling dizzy. After dilated, we talked about hypertrophic. Hyper means your heart muscles. These heart muscles are what? Are thick. They are replaced with fibrous tissues that cannot contract and relax well. That is another problem we discussed last time. But today we want to discuss a very important one, which is called restrictive cardiomyopathy. So anyone who is coming in, please don't just come in and go. Tell us where you are watching from, and like the chat, like and subscribe. Sometimes you watch and then you don't subscribe, and then you remember, oh, I heard Dr. Ben talking about this. Then you start finding, where is that channel? Please subscribe to this channel. This is a good channel, man. Sometimes you feel good when you are talking about mental health. So when I'm saying about restrictive cardiomyopathy, I'm meaning restrictive by stiff ventricular walls causing impaired diastole. The systolic function is often initially preserved. So restrictive cardiomyopathy is whereby the ventricles, your heart is very stiff and it cannot even pump blood well. You get? So when let me show you the heart muscles. These are called the ventricles. These ones are called the ventricles. These ones are called the auricles. So this auricle receives blood, brings it to the right ventricle. This one receives blood from the heart. So there is a ventricle that is I forgot. Oh, nice one. Thank you a lot. So if these ventricles are stiff and they cannot pump blood well, how will you get blood to your body? How? You will not. And now this is another one. How are you, Dr. Benjamin? Maje, I missed you the whole weekend. Hope you are doing good, Maje. Hope you are doing fine. I'm fine too. Yesterday we hung out with Uncle. It was a blaze, man. It was a blaze. I liked it. Uncle, yesterday's live was cool. Everyone liked it. So the guys that are coming in, Ridley, morning, Benjamin and family. Yes, Ridley, I've just spoken to you and I feel nice. When you speak to friends on phone and they are healthy, you feel nice. I feel good. Yes, when you speak up to your friend, you are welcome watching from USA. Rokata. Here there are so many friends of mine around USA. So Jamaican uncle is here, Ridley is here. Yes, all of them. Interact with them. Maybe you are doing something. You have a service that they need. You can interact. You have a channel. You can interact. You see. So restrictive cardiomyopathy is another funny thing. The causative problem of restrictive just meaning It is restricting the ventricles to relax and pump blood. It is restricting the vesicles to pump blood and relax. You see, that is why it is called restrictive cardiomyopathy. So, this is another thing that is caused by amyloidosis and sarcoidosis mutation. Most of this is not brought by alcohol or diseases, but alcohol and diseases can be a second part of bringing this problem. By you drinking a lot, by you taking alcohol, by you smoking, can bring amyloidosis by mutating your cells of the ventricles of the heart. So let's stop drinking. Storage disease like hemochromatosis, other radiations like radiation therapy, endomyocardial fibrosis and scleroderma. All these bring this problem of the heart. And sometimes nutrition can bring it. If genetically you have problems of these mutations that I've named, someone will say those are big names. They are not big names. Now, guys, let me introduce my people here, because someone may say, Doc, you are just telling us things and you are not introducing your people. We got Rokata, we got Maje. If you are here and you know you are my person, please say you are here. Sometimes don't just watch. Say you are in the house. Rokata Exotic, our new friend in the house. Big up yourself every time. I see Maje in the house, Maje B in the house. Thanks for tuning in. Maje, we missed you the whole weekend. We were with Uncle hanging out, and I was asking, where is Maje? Maje has got lost. Now, we have Ridley in the house. Ridley, big up yourself. Ridley, big up yourself all the time. We have a Jamaican uncle in the house. A Jamaican uncle, always the big man supporting us. Ahmed, big up yourself. I know you have a premier, nice one. Big up yourself. And El Concaina, 9512. Big up yourself, El Concain. Thank you, Dr. Ben. Kali MTN. Kali, how is the going? Yesterday I blasted you on Uncle's channel. I'm in. I miss quite a lot informative session. Hope you are doing good. When your friend gets lost, you start wondering, where is my friend? So, Kali, doctor, I was celebrating emancipation. Oh, okay, nice one. Big up yourself. That is good. When you're celebrating, we feel nice. You see, Kalin MTN, hope you have been fine. Hope you have been fine wherever you are, and you have been doing good. When you get lost, you'll be confused. So, let's continue with the topics that we have. How does this problem of the heart come? How does the mutation come? Reduced ventricular compliance. The ventricles stop pumping blood as needed. There is that force. And then the other thing is, when you pump blood from your pump blood from your heart, when you pump blood, I'm good, Doc, I'm doing well. Thank you so much for coming in. We were wondering where you went, but now we know you are here and you're doing good. When you pump blood from your ventricles, blood that comes from the left ventricle going up to the body and coming back to the heart should be 65% of the blood is here. About 65%, and it is called the ejection fraction. Removing 65% going to the body, so that when other blood comes, 65%, it's like that. But now, when you are ejecting blood and you have less than 50%, you will start having dizziness. So it is another problem. This is restrictive cardiomyopathy, is a problem of these muscles. These muscles of the heart, they don't want to pump blood as needed. So if elevated feeling pressure, pulmonary hypertension, and right-sided heart failure. Why? Because if this heart is stiff and you are pumping blood, it means the blood that is going to the lungs through the pulmonary artery is less, and so you will have the problem in this side, it will be big. This side will be bigger. It will be holding more blood. And then you will have right-sided heart failure. Right side heart failure. That is where you start having swollen feet. You start having. I want to tell you one thing. When you have left-sided heart failure, most of the time you won't have swellings in the feet. But when you have right-sided heart failure, when you see someone is having swollen feet because of heart disease, think of right side, because it is holding a lot of blood, and more blood is not going wherever it's supposed to be, so it retains, and that's why you have fluid in your feet, fluid on your face, you see, and then the kidney starts suffering. You start having something that is called pulmonary hypertension of this side of the heart that takes blood to the lungs. So what are the symptoms? You know, most of the symptoms, let me explain this, of heart diseases, they are the same. Most of the outstriking symptoms are the same, but the complications are different. You know, it is so cold today here. I'm having some green tea as we talk. Most of the complications, I want to listen to that, so that you cannot be sharing drugs. Let me put some hot tea, some green hot tea. If you are coming in here right now, tell me you are here, man. Don't just watch. Tell us where you are watching from, and tell me, Doc, I'm here and I'm watching from Canada. I'm watching from Africa. I'm watching from India. One people, different colors. Nice people, different colors, one people. So let's watch from all over the globe, all over the globe. And I usually say something. You know, people have got different problems, psychological issues, psychological problems. People have problems about medical problems, and you don't want to say, I may not give you an answer, but someone in this chat could have undergone the same problem, and by sharing your problem, that person may guide you very well. You know, sometimes doctors don't have every answer, but experience of someone can give you a very good answer and a very specific answer. So my friends, let's continue. If you are coming in right now and you are a new person, hit the subscription button, and then there is a notification bell there. It will say ding ding. Ding ding. Dr. Ben is online. Ding ding. Yes, and like the channel, So we are going on, and this is a very important session, my friends, by the way, because what I want to say is very important. People suffer from hypertension. People suffer from heart diseases. You have seen, we have talked about hypertension, we have talked about heart diseases. Heart diseases, we have talked about myocardial infarction, which is heart attack. And then we started cardiomyopathies. Cardiomyopathies, we learned about dilated cardiomyopathy, and then we learned about restrictive, the one that we are doing today, and then hypertrophic. All these people may suffer the same symptom, and this symptom, the first symptom is fatigue. The first symptom is being tired. You are just tired. The second symptom is edema, peripheral edema. Edema means swelling. Your leg swelling, your face swelling, you see. And then there is something that is called ascites. Ascites is fluid retained in your stomach, peritoneal layer of your stomach. Fluid retained in your peritoneal layer of your stomach. You see, all these things are connected to one symptom that is called to one complication that is called heart diseases. But you see, the same heart diseases are different. The same heart diseases are different and totally different in character and in how they present physically. So don't ever take a drug that someone is using. Don't take a drug that someone is using because now that person that the person that is using that drug felt well, and this person went to see a doctor, because you see that person started by feeling dizzy, and then he went to the doctor and given such drugs. Now you can have problems in this restrictive cardiomyopathy. In restrictive cardiomyopathy, you can have a problem of the swelling of your liver, hepatomegaly swelling of your liver. It swells because most of the blood is not going. It is called portal hypertension. It's not going where it's supposed to be. Here, this right side, the blood should go in, never stop somewhere, because when it comes from your body, from the vena cava, it's supposed to come to the right ventricle. Then it is pumped. After it is pumped, it is supposed to be pumped to the lungs. After the lungs, it is supposed to come back to the left auricle and to the right ventricle. And then after that, go to the body. But now, this side is where the liver is, you see, the left side. But you see, blood is retained. Blood is retained on the right side. And the side is where the tree, or from the river, you go to the vena cava, you will have hepatomegaly. All these signs are connected. Choya is here, my friends. Choya is here. How is Choya? How is Qatar? In Kenya right now, it is so cold, man, and I'm having some green tea. So that is restrictive. Let me go through them, through the words that we have discussed. 1, dilated. Heart muscles becoming bigger and open, higher. 2nd, hypertrophic. Heart muscles becoming thick. These ones becoming thick, bigger. They become thick and bigger, like thick. Even this, the septal branch becomes thick. Very hot over here. No worries. Let's talk about the other one. Restrictive. These ones are okay, the same size, but they are very stiff. They cannot relax and expand in the right way. Now, you see all these things. These things, men, are connected. They'll give you the same thing, the same problem. We have another one. Let's go through another one. I will give you another one that is called arrhythmogenic right ventricular cardiomyopathy. Right ventricular cardiomyopathy. You know, the right side does a lot of work. The right side of the heart does a lot of work. And this is where you hear arrhythmogenic right ventricular cardiomyopathy. Arrhythm is inherited cardiomyopathy in which the right ventricle muscle is progressively replaced by fibrous tissues. The muscle should be relaxing and expanding. But when you have some fibrous tissue, if you cut somewhere and it heals, you will feel that place is a little bit hard. That is called the fibrous tissue. So this right ventricle, the whole muscle, the one on blue, the one you are seeing in blue, this one, the right ventricle, it incidentally becomes fibrous. Even expanding and relaxing becomes a problem. It is inherited. This is a genetic inheritance. So you can have it is called arrhythmogenic right ventricular cardiomyopathy. Myocyte loss, the muscles lose the cells that are supposed to be there. Ventricular arrhythmias, sudden cardiac death. Someone can just collapse and go, man. Imagine, if you are in Kenya right now and where you are there is cold, man, take green tea. Take green tea, man. It's cold, and I'm in my office and I can feel it's cold, So here, the symptoms sometimes is palpitation, symptom, ventricular tachycardia, sudden cardiac death. Sometimes you just die. But there is something that the other one. Today I'm going through cardiomyopathy because the first ones were the most important. There is the other one that is called Takotsubo, stress cardiomyopathy. You have financial stress. Your boyfriend, your girlfriend has given you stress. You see, your family members are giving you hell of a time. Everyone is giving you hell of a time, man. You can't even breathe. Some people, you can get release of catecholamines can give you heart diseases, also called broken heart disease. And here, this is where we get that, people say you have heartbroken me. You have heartbroken me. People say that you have heartbroken me. That thing did not just start. Heartbreaks did not just start, Heartbreaks did not just start. It started from this physiological medical thing, because Takotsubo cardiomyopathy of the heart is called broken heart syndrome. So when you are heartbreaking your girlfriend, just know your girlfriend is telling you, you are giving me stress and my heart may fail. Physically, from emotional to physical. Takotsubo cardiomyopathy is a transient weakening of the left ventricle. Now, from the right, we go to the left, often triggered by emotional or physical stress. Emotions. Those people that are so emotional. Now you know, those people that are so emotional. Those people are emotional, they get heart attacks so fast. Because Takotsubo comes out with emotions. Catecholamine release on the left side of the heart starts to fail. Or physical exercise, So let's not get to heartbreak people. Let's not get to heartbreak people. It's not good to heartbreak people. Let's not get to heartbreak, because we don't want their left side of the heart. We don't want them to get Takotsubo. If you are new in the house, man, Dr. Ben is the one who is driving this car, and the channel is called Benjamin the Wise Guy. I can see some people are just watching and they are not telling us where they are. Tell us where they are. You are. Come to the channel chat. Come to the channel chat and tell us where you are chilling from. Tell us where you are relaxing from. Hit the like button. Don't just watch. Hit the like button. Let's relate. Let's relate and let's interact. So, when you are emotionally stressed, depressed, loss of loved one, fear, you are grieving, it can lead you to have a problem on the right side of the heart. Now, physical stress, somebody really is here. Somebody really is here. How is you? Somebody, hope you are doing good. Somebody really is my good friend. He has a ninja mask on his profile, Ninja mask. He does things like a ninja. I'm good. Somebody really. So you see how stress can cause you to have problems. Physical stress. Sometimes some people can go for major surgeries. You have been on or severe illness. Some things will give you. I just arrived at work. Keep going and get people. Nice one. It's Joya. Big up yourself. I know this is your time when you are doing things at work here and there. So big up yourself, man. Big up yourself. So stress, emotional stress, can overwork your. And when you are overworked, something happens, and you lose the capacity of pumping blood in the right way. So when people have undergone major surgeries, severe illness, you have been sick for so long, or you are under depression, you can start having left side heart failure. And that's why when people are depressed, they are told to, or when you are in hospital for so long, you are introduced to a psychologist. It's because you don't want to get home with another problem like heart disease, and we have been managing some other diseases. You see, we don't want that. These features of Takotsubo stress cardiomyopathy that is brought by depression, it kind of like mimics a heart attack. You will start feeling chest pain. You have had someone who is very stressed, and this person suddenly starts saying, I'm having chest pains. So as someone becomes confused and asks, how can someone who is depressed have chest pains? Today you are having chest pains because of something that is bad that has come up. You see, shortness of breath. Sometimes when you are exposed to an ECG, the electrocardiogram, the one that we put on your chest to check everything as it's going. Miriam, we are discussing the stress and heart diseases. You are the one who was so concerned about this one. Miriam was so concerned about her broken heart syndrome. Miriam, today we are discussing that. Now, when we expose you to an ECG, we see it is kind of like the waves are changing, are not normal. And sometimes I think people can be so stressed until the oxygen capacity to the heart and also to the brain goes down. And when people are stressed, some of them don't eat. Electrolytes imbalance in your body, like sodium, you are not getting them enough. Or some people eat a lot when they are stressed. Let's see, you are stressed, do you eat a lot? Do you eat a lot, or you reduce eating? Let me put that as a poll here, so that we can know when you are stressed. Do you lose appetite? Do you lose appetite when you are stressed? Tell us, when you are stressed, do you lose appetite? And because there are several things that happen when you are stressed. The people that lose appetite, you need sodium, you need phosphorus, you need all those, electrolytes. And when you are not having them in the right way, you start having some physiological damages. You start having hypertension, because you start having loss of energy, because your body, when you eat something that is carbohydrate and goes to your stomach, what happens is this: you need sodium so that it can pull out the glucose. Sodium is it is called co-transporter. You see, Rokata Exotic is saying when he's stressed, he eats a lot. Let's see. Paul, let's see. Someone has said no. So the poll is still continuing. I think we have 2 polls. So sodium is a co-transporter of glucose. Without sodium, you can't have energy, because it takes glucose and transports it to where it's supposed to, the muscles, So that is what happens. So when you take another thing that you may take and see, I eat less. Kali MTN says I eat less. Yes, because when you release catecholamines, you are stressed, you are releasing catecholamines. You are releasing some hormones like ibidin. Ibidin is a hormone that stops you from feeling of it. Inhibits. You see, those are hormones that inhibit you from eating. So there are some people who have reverse psychology. Instead of releasing within, they release some things that help them eat a lot, like Gairin. Jamaica Uncle, good evening from Nairobi. Big up yourself, Uncle. Alongside Ridley. Now I know you are smiling where you are. Now, there's something called cardiac troponin. When your heart is suffering, when they release troponin in your blood, and so there is a level that is supposed to be in blood of cardiac troponin. So when you have less amount of troponin, or you don't have enough amount of troponin, you have more amount of troponin, we know that your heart muscles are suffering. So it is important that when you are feeling having a problem like this one, it's very important to go to a doctor, so that this doctor can check on you and can see how you are going, because you may feel that you are dizzy out of stress, and the dizziness that you are feeling is not about the stress. It is about heart failure. You became stressed up, and now you are starting to have heart failure. We have coronary artery as usually normal on angiography. So because you are just stressed up, in Tokosubo, the broken heart syndrome, you don't have coronary vessels that are broken, you see, and blocked. Where are the coronary artery vessels? Let me put this here so that you can see them. The coronary artery vessels are these ones, from the aorta that is carrying blood that has oxygen to the body. You see these two, this one and this one, this one and this one. Those ones are coronary artery. So they are not blocked, they are okay. So when you come to a hospital with dizziness, you are having issues that are confusing you, you are having chest pains, and we see that those vessels are not blocked, and your heart muscles on the left side, the one that is receiving oxygenated blood, is kind like weak, and the myocytes, the troponin are elevated, a bit elevated. We know that this one has heart issues. This one has heart complications that are brought by stress. So here we just do supportive management. Supportive management, that we give some drugs that can help you to relax. When you are stressed, we give supportive management. A psychologist talks to you. We give you, if you are the heart has gone to hypertension, we give you some hypertensive drugs like beta blockers, but not in all patients. And within some days, you feel good. So this I want to go through all these problems that are called cardiomyopathies, and we see the difference. In dilated, the ventricles are dilated. In hypertrophic, the ventricles are thick, very thick. They are thick. I don't know if I have that picture that I drew here. Let me check. So you see, they have all of them have different ways of presenting. Restrictive, they are stiff. Restrictive, they are very stiff. The kind of relaxation, if it is stiff, relaxing becomes a problem. Sometimes it can damage if it is continuously being filled. And if it is thick, like in hypertrophic, if it is thick, pumping blood becomes a problem, because thickness the 65% of blood that is supposed to move out becomes a problem if it is thick. In arrhythmogenic, it is right ventricle are affected. Now in dilated, 65% is reduced. It is reduced because the ventricles are so big, even the valves have a space. So they cannot hold blood. Blood keeps on coming back. Usually preserved in hypertrophic. In hypertrophic, where the ventricles are thick, at least you can get 65% of blood to your body. In restrictive often preserved 65% enough blood, but in arithmogenic it depends, it depends. So it is very important to take care of your heart. It is very important to take care of your heart as per needed. Prevention. I usually talk about prevention of these problems. And how can we prevent these problems? Sometimes we don't just talk about prevention and someone doesn't know. If you are here and you know how you can prevent these complications, the first one, dilated, we talked about lifestyle. Let's discuss. If you want to prevent getting a heart disease, if you want to prevent a heart disease, your lifestyle starts first. Alcohol intake, smoking, you see, controlling of these things, smoking. Control blood pressure. If you have been given medicine by a doctor to control your pressures, take good care of yourself and don't corner here and there. Take drugs as per needed. Take those pills, because if you don't take them, your heart pressures will go up, and when your pressures are up, what will happen? You'll start having dilated cardiomyopathy, the first one, because when hypertension is there, the heart continues to be big. The heart continues to be big. So control blood pressure. Diabetes. Most of the people that have diabetes, you will get their blood vessels have atherosclerosis. They are thick valves with plaques. Yes. So if you have been given, the more you are having high sugar levels, the more you are having problems. The Bible says, guard your heart, because out of it comes the issues of life. Yes. Someone is calling me idiot. Now, how can I be an idiot when I know all this? I've seen 66. I've seen. Why are you calling someone to block that person? If you are here and you can block moderators, you can block that person. Block this. I've seen is a bad guy. I've seen. Stop doing that. You're calling me idiot. Okay. Now let's continue. Let's continue. Okay. I've seen is who is I've seen? Who is this I've seen? Who is calling someone idiot here? Why are you insulting other people on my channel? Why are you insulting other people in my channel? Yes, insults are not good. So let's continue, my friends. Let's continue. So control your blood pressures and diabetes. Take those medications as per needed. Let's talk about cholesterol. If you have a genetic problem that is about cholesterol, taking of cholesterol drugs, and if you have a problem of piling up cholesterol, and you go to the doctor and the doctor tells you that you've had this problem for so long and now you have to take drugs, please take the drugs. Fatty plaques in your vessels are not good. Fatty plaques in your vessels are not good. You should take drugs as per advised by your doctor. You see, by your doctor. Avoid excessive alcohol and illicit drugs. You saw this alcohol and illicit drugs brings other problems like hypertension. And when it brings other problems like hypertension, you start having problems with dilated cardiomyopathy. So everyone who is taking cocaine, amphetamines, alcohol, please take good care of yourself. Take good care of yourself. It is very important to avoid rather than to treat. And you see that, oh, FRC is here. FRC, greetings and everyone. Thank you for tuning in, FRC. We are talking about taking good care of our hearts so that we can avoid cardiomyopathies. We moved from heart attack and right now we are on cardiomyopathy. So alcohol and illicit drugs, let's get them away. Things that stimulate the body, get them away. Treating infections promptly. Infections can bring problems. Infections can bring problems. And why infections? Infections have tendencies of, you can get rheumatic heart disease through infections. You can get rheumatic heart disease through infections. And you see, when you get rheumatic heart disease and then your heart valves, these heart valves are involved, what can happen? You will start having problems when it comes to heart pumping blood. You will get aortic regurgitation, you see, then you start having dizziness. And then if it is right heart, you get some things like arrhythmogenic or Takotsubo heart failure, the ones that we have discussed. So take care of infections. Sometimes some people you end up getting a boil. And when you get a boil, you don't treat it promptly. You burst it, you drain it, you don't take antibiotics. You leave something that is called Streptococcus pyogenes in your bloodstream, and you know that thing is the one which is very vibrant when it comes to rheumatic heart disease. So because you think you have drained the pus and everything is okay, and you are told to buy antibiotics, you say, I don't want to take drugs. Maybe you drink alcohol. You see, treat infections promptly as per doctor's advice. You see, and then sometimes some people have flus and they go to a doctor because they have fever. Immediately the drugs this person was given, flu symptoms subside. Step taking medication. 1, efficacy. The drugs that you are taking have not cleared the infection as per needed. You had a flu. Remember, this part of your head is kind of like connected to your brain. In your brain, you have something, you can get meningitis, be it fungal or bacterial or viral. So you have flu, and there is a point of weakness here that goes to the brain, which is the sinus. You see, so you start having rheumatic heart diseases. In your family, there is no genetic makeup of arthritis, but because of you being complicated and not following instructions, you end up visiting the hospitals more than needed and getting diseases that you will not get. So treat infections promptly. Treat infections as per needed. Exercise appropriately based on medical advice. Exercising. Exercise releases more insulin to your body, and then when more insulin is released to your body, more of glucose is broken down, and then the storage capacity of cholesterol is reduced by, there is no more glycolysis that is going on. You see, so it is important you do exercise. It is important that you do what? You do exercise to continue releasing more insulin. Insulin is important to your body because it makes very many things go right. 1, reduce of high glucose to low so that it can balance. 2, reduce of glycolysis and cholesterol formation. People think when you take foods that have high proteins and fats, you are giving yourself cholesterol. Man, when you are taking more carbohydrates, you are creating room for more cholesterol to be formed. Yeah? Screening first degree relatives when a genetic cardiomyopathy is diagnosed. So mostly not dilated, because dilated you can, that one comes because of lifestyle. But hypertrophic, the thickness of your heart, the stiffness, the restrictive, that one is called stiffness. And the other ones, not mostly the Takotsubo, no, broken heart, no, that one is stress. But the two, restricted and hypertrophic. Restricted is the ventricle are stiff, they can't pump blood well. And the hypertrophic, they are thick and big. They are thick. So there are some things like sarcoidosis, amyloidosis, those complications of mutations. They are genetic. Those ones are genetic. You should first, when you are found that you have it, if your parent is alive, the parent should be screened to see if it is a genetic thing. So if it is not a genetic thing, J. Hank is in the house. Big up yourself, J. Hank. Thanks for tuning in today's topic. We are just learning how to take good care of your heart when you find there is a problem. So when you find out that your parent does not have this problem, what do? We can't find we can't search other problems. Do you have an infection? Do you have an infection that is making you have this problem? Have you been under a lifestyle that is causing you to have this problem? You see, because genetic screening will guide your treatment. I usually tell people, when you go to a hospital and you're told to do some tests, don't overrule and say, I just want drugs. They may save you a lot of money on doing things that are unnecessary. Now, let me say that you go to a hospital. A doctor tells you, let's screen this, and this. And then you say, no, these are too many things and they are very expensive. And then you go to another doctor, a physician, a medical health person. The other medical health person tells you that, let's just start drugs. Now, you are given antibiotics. They are not working. You come back later, you are given antifungals. They are not working. Now, the doctor sits down and thinks, oh, it might be viral. You are given antivirals. They are not working. Now the doctor thinks, what might be the problem? What might be the problem? You sit down, you think, and then you come back. Now you are referred to someone. That person now tells you, now let's do this, and this. And then this person does genetic screening. You find out that you are having a genetic makeup that is giving you that. Then you have wasted a lot of money on drugs. Now the treatment of the genetic problem is really different from what we have been undergoing. Simple, I'm advising everyone. It's good. It is very important you try your hard. You try hard to screen yourself to get the real problem, rather than to start medication without screening and knowing what is important. And that is where people go to hospitals and problems start. Those doctors that they say, if you go to that hospital, you are done a lot of tests that are not necessary. Tests that are not necessary. It is rather you know how good you are, better than start medication without knowing where is the problem. You see. So we continue, my friends, we continue here. We have taking prescribed medications consistently. Yes, today we are going for a party. I will not take those drugs because I'm going to take alcohol. We have traveled. I forgot my medication, but there is no problem. It's just one day. I'll go back and take them again. Just listen to those quotes. You see, there are some medications that when you are given, they are like a dose, and the brain and the body will always, like hormonal drugs like levothyroxine, those drugs, and family planning pills. You see, pills that contains progesterone, estrogen, all those hormones, menotropin, all those. You should take them when they are needed, because the dose, the ejection of the dose, is monitored by your body and your brain. So when you irregularly jump, you take the dose today, tomorrow you are not taking them. Even antihypertensive and heart diseases like heart tablets and drugs like carvedilol, beta blockers like propranolol. Those are drugs that you are supposed to take them when you are supposed to. This issue of people taking drugs wherever they want and they are not professionals is very bad. Or taking overdoses so that you can feel better. You may collapse one day taking an overdose and thinking you are doing the good thing. It is very important to take drugs when you are told, and stop confusing yourself that you learn your body more than the doctor. I've heard some people saying that, me, I know my body. For me, I know my body. Wherever I'm sick, I know. And wherever I'm having problems, I know. It's okay. Some symptoms that you are facing may not really mean that you are sick. Some symptoms that you are not having may not necessarily show that you are okay. It is not a must that you have dizziness so that you can know you have heart complication. It is not necessarily you have chest pain so that you can know you have heart complication. We have different types of presentation according to the person's age, genetic makeup, and also according to the person's weight and gender also. So you are supposed to follow doctor's advice because they are the professionals. Your doctor is the professional in that field. Treating yourself may put you in danger at times, but following advices may help you to maintain your physical health and life. So medications of prescription are very important. And I will come. I think I have anxiety. Can I lead to heart problem if not better? Yes, you should know how to control it. Anxiety disorders. We talked about anxiety disorders, I remember, and we said they may lead to heart complications. And here also we see Takotsubo has brings heart complications. So learn to control it. Learn how to manage anxiety in your life. Learn how to control anxiety. Don't just be like those people that say, I know my problem, it is this. No. You can maintain and get away from anxiety. You can learn how to get away from it. People say the I don't care character. People say that when you have anxiety, start learning how to have the I don't care character. But don't be the real I don't care. It is helping you to get away from. If you can't manage it, find a psychologist, find a counselor, find someone, a family member who can help you and guide you through out of these anxiety disorders. I think I have to come a day and we talk about medications of prescription medications in details, because people really are confused about taking prescribed medication consistently and what are the medications of prescription. If you are telling a person that, let's say, go over the counter and bring me paracetamol, someone else will tell that person, you just go and bring me tramadol from over the counter. Both of them are painkillers. But you see here, we are saying when you're having these heart diseases, taking prescribed medication consistently and the right medication may help you to stay away from complications. So people sometimes don't know how to buy drugs over the counter. And it is so sad that some people that are on those facilities, that are selling drugs, and some of them that just say, imagine you go over the counter, a child, you are asking, can you sell me benzoxine? And because this is a child and as an underage has walked, or a teenager has gone around finding that drug, that drug is being abused by teenagers. He has got it here, who is willing to sell, he'll triple the price, and then it will just be bought, not knowing that you are giving this person some years to come with problems. You are giving this person some years to come with problems. So I think we'll come with a topic of over-the-counter medication and prescription medication. Prescription only medication, so that people can know. Like in my country, there are some people who just sell medicine. There was a time some years ago, you could go and find even antibiotics in shops. Imagine, anti-malarials. You go in shops and you find anti-malarial. So a person goes over the counter in a shop, but nowadays it's not. Nowadays it has we have upgraded. A person goes and in a shop and says, give me anti-malarial, the one that is called malaria queen, those days, and you are given. You go and overdose yourself and die. You see, nowadays I think there have become at least regulations and restrictions, but some other crude medical personnel are still doing funny things behind their private and even some hospitals of the government. See, so let's learn how we will learn how to go about the medications of prescription, and we will learn how to understand these medications. Which medications should we take over the counter, and which medications should we not get over the counter? And maybe I will say this. There is sometimes a relative or a friend may be given a painkiller, and some drugs work differently. It may be a painkiller and it has been given because of another cause, and then incidentally a friend or a person who is close to you does what? A person who is close to you has a headache and immediately takes the drug because you have them and they were left alone. You get that drug. It works so well. So many drugs that are with codeine, and they have these painkillers that are blended with codeine are so effective. Why? Because African village girl, hey, welcome to the chat. I saw you were asking me if I'm in Kenya. Yes, I'm in Kenya. I'm in Nairobi. I'm in Kenya. I'm a Kenyan. Now, because you are left with some medication, you assist your friend out of good heart. Now it works correctly because you are having a headache, and that drug has paracetamol and codeine. The headache comes down and you go high a bit. So because any product that has codeine will make you high, will give you that fika feeling, So before I continue, let me welcome African village girl and everyone who is watching. If you are watching and we don't know you are here, please hit the like button and tell us you are, As you watch, tell us you are in the chat. Let's continue coming in, and also you can rewatch the other lives. And people ask me, why don't you have more videos? Man, I have a lot of work. Producing videos is a heck. So I come live like this one. So if you need my videos, you go to my live. You learn matters concerning menstrual periods, matters concerning diabetes, hypertension, anemia, all those, and we'll be repeating the important ones. So welcome everyone who is watching. If you are here and you are a new person, don't fail to subscribe. Don't fail to subscribe here, and you will feel nice. So I'll be back for 10 minutes. In the back for 10 minutes. No worries, Rokata, no worries. If you are here and you have not liked, my friends, please hit the like button. Hit the like button and tell us where you're watching from. Don't fail to hit the like button. Now, African village girl. Now you know I'm in Kenya. I'm in Kenya where you are. I'm in Nairobi. You asked me that question. And now you know I am in Kenya. Kenya is my country. Some people are confused. Most of the people ask me, how is Jamaica doing? And then I'm confused. Jamaica again. Jamaica again. I have more friends in Jamaica, right? I have 4 friends in Jamaica, and I'm a Kenyan. I think that's why. And we hang out with Jamaican uncle so much. I think that's why people are confused. But no worries. Let's continue. So I was saying, when you take those drugs that are blended with substance like codeine, you feel the headache has gone, but you feel irate, you feel nice. You know, a person who has never taken drugs like cocaine, a person who has never taken something like let me say marijuana, and now you are giving this person a drug that has codeine. Just imagine, this person goes to bed, feels irate. Yes, the codeine has hit the brain. So tomorrow waking up, the first thing he'll ask is, hey, my friend, you remember that tablet you gave me? Man, it was a bomb. I want like that one. I want to sleep, man. Give me that tomorrow. So you had like 3-4 tablets left. You give 1, 2, 3, and then they are gone. So this person will start working with that packet. I want that one. And a rogue person will come along. A rogue person will come along and will want to sell the drugs for this person. Those people that just sell anyhow. Now this person will come addicted to the drug. And addiction will lead to left-sided heart failure. You see, drugs and alcohol leading to left-sided heart failure. So let's not get our friends. Sometimes people don't know, but out of goodwill you help, but out of helping it brings a problem. So let's not get our friends and relatives in problems like this ones. If you are given drugs, they are your drugs. If they are left before you give someone, unless that person was such a medication and you have them, don't purport to give when you don't know what you are giving. Leave that to the professionals that are of medicine, as the people that are legal medical practitioners, legal drug dealers. We call them legal drug dealers. So big up yourself, my friends. If you are still here and you are watching and you have not said hi to me, please say hi to the doctor, man. Say hi to the doctor, and hi, and hit the like button. If you are still watching, hit the like button and subscribe. Check if you have subscribed to my channel. Subscribe to the channel. There are some things that people should do. Attending regular cardiology clinic. Oh, thanks. I have known you are from Uganda. No? Because I love Ugandan songs. Nikutimba nyu, oh na na na, waseka wera kwasemba yo mabu. I love Ugandan songs. So, African Village Girl, are you in Uganda or in Kenya? I think you are in Kenya, right? Yeah, I think you are in Kenya. So there are some things that you should do once you realize that you have these problems. This is very important. Once you realize that you have this problem, it is very important you start attending clinics, so that the revision of your drugs, the doctor can see how you are progressing. And you see, a disease like dilated cardiomyopathy is not that disease that you'll give antibiotic and then after 3-4 days you are okay. Oh, African Village Girl is in TZ. Welcome, welcome, welcome. Thanks. The land of Bongo, land of Wasafi, African Village Girl. Tanzania, the land of Wasafi. Big up yourself. We love Bongo. They are good music. So you don't want to go to clinics. People call them clinics, general clinics, cardiology clinics, medical clinics, gastro clinics, all those types of clinics, name them. You don't want to visit the clinics. And the other thing is, when you don't want to visit the clinics, how will you know how you are going on? There is a guy that took a long time coming to the clinic, and then I asked this guy, what has been happening? He told me, doc, when I'm not feeling okay, when I'm not feeling okay, my body tells me, Bwana, you need to go to see the doctor. But when I'm okay, I feel it, so I should not come. Hey. When your body tells you, it's better you go to the hospital to be checked. It may be boiling and you don't know. You are not having signs. And you have seen there are some more conditions that boil without signs. And then you just get, let's see, a person whose blood sugar levels are going so high. A person whose blood sugar levels are going so high. Going so high. And then you are just taking water, feeling everything will be fine, making yourself easy with what you are feeling. And then the next time you are in hospital, you even don't know yourself. You get into a condition called diabetic ketoacidosis. You are in a coma. These are called clinics. Diabetic clinics are very important. Cardiological clinics are very important. Cardiological clinics are very important. The evaluation after like 3 months, the evaluation after 3, and you are on medication. When you are on medication, please take care of yourself well. Take good care of yourself. Go to clinics. Explain to doctor even that simple thing that you think it is not necessary. That simple thing that you think, even this one the doctor needs to know. Tell your doctor. It may be an eye-opening of something that may lead you to stop those medications that you are taking. You see, and this is where men go wrong. It is very important, men, to go to hospitals. Men, it is very important to go to hospitals. I think many men, they see, if I have a family, and people see me going to hospital, and the family is depending on me, it may be a problem. It will bring a problem because the other ones will start having issues. They will start having stress. The breadwinner in the family is having an issue. So what about us? So men don't reason like that. Always go to hospital. Even if someone will not know. I once said that one day we organized it is called a medical camp. We organized a medical camp to screen, free screening of these genital issues like prostate, cervical issues, and it's a rare thing to get this opportunity. And we said everyone to come. Hey, women came, many women came, but for our surprise, we got 5 men. Only one accepted to be screened. The others came to listen and go. And I'm very sure the one who came to listen and go, they were following their wives to see what are they coming to do there. Very funny, right? So let's get it, let's normalize men going to hospitals. Even if you will not tell your person that, I've been in hospital and I've been told ABCD. Come to hospital, screen yourself. Let's learn to listen. Men never listen. There are some people, men, when you are telling them, your problem is brought by alcohol. This man will tell you, but my grandfather took alcohol until he was 90 years. He died a noble death. That is a man telling you. But now if you tell a woman, please stop smoking, tomorrow you will not see that woman with that stick again. They are very disciplined when it comes to following rules. And if you see a woman is having a problem, if you see a woman is having a problem on following medical rules, just know this lady is under some severe depression. Women know how to follow rules and know how to do things. So, my friends, we are just talking about avoiding heart diseases and guiding ourselves on. I'm back, guys. Thank you so much, Raptor Exotica, and guiding ourselves on important issues that we should be following and we should be being guided on. So I usually say, if you are talking to a person, and yes, I'm texting someone. So if you are talking to a person and this person is not listening to your guidance, you just share the person, my contact. Just share my contact to that person, or share this channel to that person. It may help that person so great. Don't always be that person that you are not giving out information. Sometimes when you are not giving out, you don't receive. And mind, this is something that you need to check. Most people that share, they get a lot, even information. When you hold something for yourself, you getting something becomes a problem. Getting more becomes a problem. And that's why people that share a lot, they have good heart, they continuously rise and rise. So we have been talking about prevention up to attending regular clinics. And I want to go through these complications that you have. And if you have something that you want to ask about these heart complications, this is the time that you will love to ask. Any general question that you think you have, this is the time you have to ask. You have heard Jamaican uncle saying, I have an appointment. It is not that Jamaican uncle is sick. No. It is not that he's always going to hospital. No. He is concerned about being healthy. And the appointment to the doctor is to go and have a chit chat to the doctor. Some people when they go to see, those are appointments, general appointments. Some people, when they see their doctor, they just smile and be good, But when you stay so many times without seeing your doctor, you become a problem. You start having a problem. Dilated cardiomyopathy. What is, I am going through whatever that we have learned. These other heart problems. It is dilated cardiomyopathy, means enlarged, weak heart, and it has reduced pumping. So it is pushing less than 65% of blood from the heart. Systolic dysfunction. Let's learn about hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy. Thickened heart muscle with impaired relaxation and possible outflow. Dr. Ben, I would love us to meet you, bro. Yes, just organize. Tell me a date and then I'll check with my secretary, and then we meet. With me, Mimi Jehang, with me, I'm an open heart. If you want to know, ask Jamaican uncle. I'm a person who is open heart. Just tell me. I told you to share your number so that we can discuss it. Just share your number and we will organize about it. Hypertrophic cardiomyopathy. Jayhank, I'm saying that because we should meet when I have time. Not that time you have come, we meet, and then I'm having patience, I'm being called after 20 minutes. We will meet together one day, Jayhank. Very soon, Jayhank. Jayhank, please share your number to me. Before this weekend, I need to get your number, right? And I don't know how I'll get it. You can SMS me on my Instagram. Or send me via my email. I need your number, Jayhank. Now, and Jayhank has a podcast, right? A very nice podcast that is showing people about disabilities with a friend. I saw it. Has posted about having a podcast with a friend about concerning disabilities. Jayhank, what time will it be there? I might be there helping to answer some questions that are medical. If you can use StreamYard, it can be good. Jayhank, if you can use StreamYard or any other way, it can be good. So let me know when we will be having that live so that I can be there and assist people with some medical questions and some medical tips. Now, hypertrophic cardiomyopathy is thickened heart muscles with impaired relaxation and possible outflow. Impaired thickened heart muscles. Dilated is enlarged weak muscles. Hypertrophic, they are thickened heart muscles with impaired relaxation. They can't relax well. You see, the outflow is obstructed, an important cause of sudden cardiac death. So this is what can make you have cardiac arrest. If the blood is not flowing as needed, if your muscles cannot pump out blood as needed, what are you waiting for? A risk of cardiac arrest. You see. Then we have learned about this one that is called restrictive cardiomyopathy. Restrictive cardiomyopathy, which are stiff ventricles causing impaired feeling. If you are here, my friends, and you have a question, please just put it out. I see time is going and going. My 1.5 hours is about to go. Sudden cardiac death in young athletes. When you see young athletes have been running and pumping. When you are doing exercise, you are gymming, you are doing gym a lot. When you are gymming a lot, you are running a lot, your heart muscles, they kind of like thicken, they become big. So you have hypertrophic cardiomyopathy. It can lead to That's why when you are doing some things, when you go to gym, please liaise with the gym instructor. Don't just do your things. Don't just do your things. Liaise with the gym instructor at who is there. Let the gym instructor guide you on what to do in the right way. You check. Liaise with the gym instructor. When you are running in the morning and you want to cut weight, when you are running in the morning and you want to cut weight, please do it in a healthy way. Don't run kilometers in a week. Your heart muscles may start becoming hypertrophic and it may bring some other problems. Athletes mostly die because of hypertrophic cardiomyopathy. As they run to win, they run to get these problems. You see? Now, we have the other one which is called, that we have discussed, restrictive cardiomyopathy. Stiff ventricle causing impaired feeling. Stiff. They cannot relax. These ventricles, these ones, if they are stiff, they cannot relax, and you cannot pump blood out as needed. And you know, one thing, once your blood is not pumped out as needed, you have problems in your body. When I do gym, my heart races, and that feels good, but if I walk miles, I feel fine. Yes, when you are gymming, you are forcing your heart to pump blood, to make oxygen reach where it's supposed to reach by force. But when you are walking, you know it's systemic, and it's good you are walking in a rhythmic way. So when you go to the gym, those people that have just started going to the gym, please be besides a trainer who knows what he's doing. When you are starting to train to make your body healthy, get consultations, because you may start and end up having a problem and you wanted to get rid of the problems. Now we have ARVC, arrhythmogenic right ventricular cardiomyopathy. Arrhythmogenic right ventricular cardiomyopathy. The heart itself, Joao Batista, how is you? It's been a while, right? Hope you are doing good, Batista. From Brazil. My sister, you are my friend. I remember you, no worries. I know you are from Brazil, and I told you one day I gotta be there. I gotta be in Brazil. My traveling next year will be, 1, to meet doctors all over the world, 2, Jamaica, the land of reggae, to feel the reggae vibes, to feel where reggae came from. So, arrhythmogenic right ventricular cardiomyopathy, the heart muscle is replaced by fibrofatty tissue that cannot pump well. You know, muscle is not fat. A muscle is not a fat. Muscle is not a fat. A muscle is a muscle. It should not have fibrous layers and fatty tissues. No, because it will not pump blood as needed. So, in arrhythmogenic right ventricular cardiomyopathy, fibrofat replacement of the right ventricle myocardium, leading to ventricular arrhythmias. Arrhythmias are either too low, faster, or very fast, causing something that is called, tachycardias. Tachycardias of heartbeat, high rate of heartbeat. But we have the other one which is called fibrillations. Even it is beating so fast until it is just vibrating and it cannot pump blood. So Takotsubo cardiomyopathy is the other one that we have talked about. Stress. That one we have talked about stress. Stress leading to heart failure. Now, as we go on finishing, I know someone has a question and you are not asking. And I would like to ask everyone that is watching, we love entertaining ourselves. We love good channels to make us laugh. But it's time now we embrace channels that are giving it a sense of life. We embrace channels like these ones that are giving us, most of the people here are those that want to learn and get away from something that has been disturbing, or they have an experience of something and they want to know what happened, and even students. But it's time you just need to get information, because you never know what will happen and what is happening at the moment. So let's share my channel, my friends. I'm just requesting everyone to share my channel, share to your friends wherever you are. Joao Batista, please bring me more friends from Brazil. Rokata, Jamaican uncle, as always, he is the one even who started this channel. Jay Hank, all of them supporting me. Smiler in the city wherever he is. Big up every time. So, let's talk about Takosubo as we finish. It is stress-induced, usually reversible left ventricular dysfunction. We have talked about it. Takosubo. So anyone with any question that you need me to explain about the heart, we have talked about the heart so much. We have talked about the heart so much, and it's time we ask any question before I go. Today we are not playing music. It is a Monday, a very cold Monday here. Hi, Coffee Cakes. Coffee Cakes is here, my friends. It is a very cold Monday, and I'm even having a jar here of some cool green tea. Give me a question that we can discuss now that I've talked about this, but tomorrow I will be talking about a very important topic. I'll be talking about a very important topic that is called over-the-counter medications and prescription medications. Over-the-counter medications and prescription medications. So, if you are here and you love to know about over-the-counter medications, because there are so many people who don't know what is over-the-counter medications and what is prescription medication, and why should you go to a licensed pharmacy to get drugs. Many people don't know. Let me tell you the truth. People will just go to any pharmacy to get drugs. And they don't know why it is written a licensed pharmacy for medical prescription. Those people that are prescribing those drugs, they know the toxicity levels and they know how to give. Even the paracetamol that people take, paracetamol can damage your liver. So don't just take medication, and don't just pick medication from any vendor. Go to a licensed vendor. A vendor that is licensed and is licensed to, because they are trained on ways to give medication. They are trained on ways to prescribe, to give. Sometimes when you take a prescription to a pharmacy from a doctor, a person who is trained will advise you on how, because sometimes when you are from the doctor may not have time to explain you so many things. So when you go there, as you take the medication, this person will advise you. Coffee Cakes, how are you doing? Hope you are doing fine, ma'am. Yeah, I hope you are doing so cool. It's very cold here in Kenya today, where I am. I don't know other places, but it's very cold here. But we thank God for the cold. I know sometimes when it is cold and it is sunny, the transition brings so many diseases because of the dust. Onik. Where do Onik go at times? Onik, sometimes you just get lost. But today I see you are here. Hope you have been doing good, Onik. Hope you have been doing good wherever you are, wherever you've been. So those are the 4 cardiomyopathies. We have talked about in heart function disease. Let me review this as we go on, because I want to finish. I'm doing good, Onik. You are the one who is getting lost. You are always in and out. Just a minute. We started learning about the heart, how the heart pumps blood, how the heart takes blood around your body, and then we talked about congenital heart anomalies. When I say about congenital, I mean the ones that you are born with, problems that you are born with, and we divided them into 2: cyanotic congenital heart defects and acyanotic congenital heart defects. I am having a big problem every time I get a medication. I read it and then I am afraid to take because of the side effect. But now, if you are given by a doctor, why should you not take them? Because the doctor has trained, the doctor has trained and knows the side effects, and that's why. Before I continue about the one what I want to say, let me tell Rokata this. Before a doctor prescribes medication, there is something that is called pharmacodynamic and pharmacokinetism, whereby this doctor knows how the body will react to the drug and how the drug will affect the body. And there is something that the doctor has taken into consideration. The doctor has taken into consideration something that is called bioavailability. How much of the drug will be in the body? The last thing that the doctor has taken in consideration is half-life. How much of the drug will be broken down, that will be available with in relation to the amount of about half of it in relation to the amount of drug that you've taken. It is called half-life. So don't worry, all these things doctors have learned, and that's why a doctor that is trained giving an overdose is a problem. Is not easy. All these things are in consideration. So don't worry yourself, don't be worried. As long as you have been given to a trained doctor, take your medication. So I was just going through a recap of what we have started, what we have learned. Yes, they have a smoking, coffee little bit, but smoking has worse effects, because now it is inducing free radicals. The other thing it is inducing is bad things like tar. So Onik, please don't smoke. If you are smoking, don't give yourself free radicals. You'll get some cancers. So we divided heart anomalies when a child is born at cyanotic and cyanotic. When I'm talking about cyanosis, I'm saying a cyanotic, it means you have the problem but you have normal oxygen. Cyanotic means you have the problem and it is giving less oxygen. So we talked about several things that we learned about, like left atrial septal defects, defects from the atrium to the septum of the heart. We talked about it. We talked about ventral septal defect. Ventral septal defects. You see, let me put, this one are problems that people are brought. Atrial septal, a hole here, like oval, the one that closes when a child is born. Those are problems that people, maybe a person can foramen oval. A child can be born. I don't smoke at all, but doctor answered the question was interesting. Yes, it is interesting. It gives bad effects. So foramen oval can fail to close and you have the problem. Ventral septal defect can be a problem. Ventral septal, it means there is a hole here, and these ones are called cyanotic. Cyanotic means you have oxygen but blood is not enough. So ventral septal effects, and then we have patent ductus arteriosus. Patent ductus arteriosus is here. You see, the blood comes from the outer and then it gets to pulmonary pulmonary artery. You see, that is another problem that we discuss. You can go to the the video and you learn. We talked about this one, outer to here. Now those are things that we talked about. Now let's talk about, that is a cyanotic. There was cyanotic tetralogy of Fallot that is composed of 4 things. Ventricular septal defect, you get a person's heart that has septal problem. Pulmonary stenosis, this pulmonary artery vein is small, overriding aorta. This aorta is overriding the pulmonary and is coming the other side, and right ventricular here is big. That is called tetralogy of Fallot. And then we learned about something that is called transposition of great arteries. The pulmonary artery, instead of coming here, it has come here. Let me show you. A child is born with this pulmonary artery that is here and this outer that is here. So when you are pushing blood, it is coming deoxygenated blood to the body instead of oxygenated blood. It is called transposition of great arteries. You see, I know one thing, the heart functions very poorly in people who are significantly overweight. How does the brain function in such people? Normal. The brain functions normal because it is protected by dura mater and blood-brain barrier. So it is normal. It functions normal onic. The only thing that suffers is the heart and blood vessels. The veins, the arteries, they suffer a lot, you see. So those are the things that we started with, congenital heart defects. And then we talked about now this heart attack, which we said it is called cardiomyopathy. Not cardiomyopathy, it is called myocardial infarction. And then we came to cardiomyopathies. And cardiomyopathies, we have seen there is several. Now, thanks a lot for everyone who has tuned into my channel. Please continue sharing, and if you have not liked, hit the like button. Or is there anyone who still have a question? As I come, let me put this heart here and relieve myself. If you have a question that you love to ask, look at that heart and ask the question as I come on the chat. Yes. Good one. I see there is no question, or there's someone who has a question. It's just been good. Like we are going to 2 hours. 2 hours, man. Anyone with any question concerning the heart and the topic that we have been having? Anyone with any question concerning the heart and the topics that we have been going on? If you are coming on as you finish, please check. If you don't, share your doctor. Share your right screen. Oh, nice one. Share. Let's have more and more people coming in and reading and watching and learning. I served to Dr. Ben already. Thank you so much, Rokata. Rokata, exotic country are you coming from? Remind me, please, as I not care for adequate oxygen. tetralogy of Fallot. So when you hear that a cyanosis, just know we say there is no oxygen is enough. Counter medication is cheaper. Miriam is saying over-the-counter medication is cheaper. Yes, over-the-counter medications are cheaper, but the problem is they are cheaper, but the damage continue becoming bigger. Taking drugs diagnosis. Doctor, please repeat. Oh, I'm saying acyanotic means adequate oxygen. Cyanotic means there is no oxygen. So when you hear about cyanosis, heart disease, just say 5T, tetralogy of Fallot, that complication of 4 problems, transposition of great arteries, tricuspid atresia, the tricuspid valves, they have a problem, tragus arteriosus, and total anomalous pulmonary venous return. These are things that we did them some times back, but I may repeat one day if you didn't get it correctly. Rokata, is that what you are asking? Rokata, which country are you from? Please tell us which continent or country are you from, so that we know. Most people here are from US. Most people here are coming from Kenya. Yes, USA. Oh, yeah. Thank you so much, Rokata, for coming from USA. Miriam is from Kenya, humble lady from Kenya. You may subscribe to her channel too and promote her channel. Onik is our friend. Onik from Armenia. You are welcome. Onik from Armenia. So everyone who is watching and is coming here, it's time. I have 9 minutes. 9 minutes to go. It's time that if you have a question, just ask. If you have a question, just ask. Ask any question you have. Any medical question. As I wait for my time to collapse so that I go. Yes, I'll do when life is over. Yes. Onik from Armenia, how is you and Fiona of Uganda going on? I left when you are planning to visit Uganda. You were planning to visit Uganda. Did you visit Uganda to go and see Fiona? Tony Lee Penga. Yes. If Efasi Lipenga is here, I can see another person that is called Tony Lipenga. Fiona divorced me. Oh, sorry. Efasi Lipenga, if you are here, is Tony Lipenga your relative? I can see someone here, Tony Lipenga. Tony Lipenga. Yes. I still have some minutes. How many minutes are those? Let me see. Anyone with any question before I sign out? Onik is single. Onik, are you single? Miriam Muko is asking if you are single, Onik. Yes. Onik, answer that question. Anyway, thank you so much for everyone who has watched. Let's meet tomorrow as we talk about over-the-counter medication and prescription medication. Bye bye. Have a lovely evening.